Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. As you can probably tell by the name of the video, it's a very interesting case. So the patient who attended today, and I promised them that I'd upload their video today. Normally, if a patient attends with an Apple device, we can airdrop the procedural video to them, but this patient didn't have an Apple device, so I said I'll upload this for them today, so I hope they're watching. So I'll just give you the case history. It's of a patient who back in September 2023 developed migraines, typically on the right side of their head and their face. And they found that if they applied some pressure just on the inside of their right eye near the bridge of their nose, that it would alleviate their symptoms. So it's still being investigated, and hopefully their migraines can be resolved. However, a couple of months later, back in November 2023, the patient developed viral flu-like symptoms, and it caused their right ear to be blocked. So I assume they developed a bit of eustachian tube dysfunction, so some inflammation of the upper respiratory tract, which then occluded the opening of the eustachian tube where it connects to the back of the nose, the nasopharynx, which then meant the patient wasn't able to equalize their middle ear pressure, and any remaining air in the middle ear would get absorbed by the cells in the middle ear that's lining the middle ear, the mucosa cells. And that then creates negative pressure in the middle ear, so your eardrum, especially the pars lucida, which is the top part of the eardrum, and also the posterior superior quadrant. So when we're looking at this, their right ear, we're looking around 10, 11 o'clock, that region of the eardrum will get sucked in. And if that eustachian tube doesn't unblock itself naturally, then middle ear fluid that would normally drain out of the eustachian tube will then start collecting in the middle ear cavity, and instead of there being air, there'll be fluid. So I assume the patient developed a bit of eustachian tube dysfunction and middle ear effusion. So at the beginning of December 2023, they went to visit their GP, and they were advised that they've got wax. So they were told to use some olive oil drops, but they were also prescribed an antibiotic and a steroid topical spray. And they were advised to try and flush out the wax themselves using a shower head. You should have seen my face when the patient told me that. So that's a big no-no, guys. Never do that at home. So they used the drops. They didn't, thankfully, use the shower head trying to flush out any wax. But the symptoms were no better. So at the end of December, I suspect between Christmas and New Year's, they went to a private hospital. They weren't seen by a clinician. I won't name this place, but they are advertising heavily for earwax removal. They saw someone who advised that they've got a little bit of wax, but it doesn't warrant removal. The patient's symptoms continued, so beginning of January 2024, they went back to the GP, and the GP, it was a different GP I think this time, advised that they had a smoker's eardrum, and they were prescribed some oral antibiotics this time, and they then went back a week ago, I think, and were prescribed another course of oral antibiotics, and there was no improvement in this patient's symptoms. They did find that performing the Valsalva, so that's when you close your mouth, pinch your nose, and gently blow into your nose. What that does, it builds up air pressure in your nasal passages, and at a certain pressure within the nasal cavity, it can stimulate the muscles that line the eustachian tube to contract and therefore open, and the patient found that temporarily did improve their symptoms. So this patient was completely bewildered by the phrase a smoker's eardrum, so they went online, as we now do, and Googled in what a normal eardrum looked like, so they can, and also a smoker's eardrum, to try to make the comparison and differentiate between the two. Of course, I've never come across that terminology, but I think I knew what they meant, like a wrinkly and type of appearance, and that's what the patient described later. They said the doctor, what they meant by it was the eardrum was very wrinkly, like a smoker's skin would be. So the patient attended to see myself. Now, the patient has got long-standing tinnitus in both ears. Rather non-troublesome, but we've got to be wary of that when we're performing microsuction, because obviously that does introduce noise and that sometimes can exacerbate tinnitus. So I'm using the fine end suction probe here. But also they suffer from hyperesthesia, so they've got increased sensitivity to particularly to touch. Their legs in particular, they're going to be careful because it's very sensitive. So it made the procedure very, very, very complex. And on a couple of occasions, the patient experienced the caloric effect. So each of our ears, in the inner ear, not only do you have the organ of hearing, the cochlea, but you've got the organ of balance, the vestibular system, the 3 semicircular canals. And when you vacuum inside the ear, particularly if you're close to the eardrum, it reduces the ear temperature. Now, when you're sat still, your brain is receiving equal messages from both organs of balance from each ear. But when you vacuum one ear, it reduces the temperature of that particular ear, which then inhibits the function of the organ of balance in that particular ear, which results in that organ of balance sending less signals to the brain. So this patient's brain, whilst we're performing microsuction, because of the reduced temperature, it was being tricked into believing they were moving towards their left side, and that's because they were receiving more signals from their left organ of balance. And then the eyes get confused and think, well, this is not right, we're not moving, and they try and correct the brain, and you experience vertigo, so sensation of the room spinning around, you spinning around the room, and some people can really feel sick. And when you're doing it, when you experience that during microsuction, it is short term, within a minute or so. It does resolve. I try and advise my patients to fixate their eyes on the tip of their finger, so ask them to hold the finger in front of them. If you close your eyes, the vertigo can sometimes become exacerbated. So it's by fixating on a point, your eyes know that you're looking at a particular point, and it's then trying to correct your brain. So that helped, and it settles once the ear temperature rises again. So there are quite a few challenges. The skin, as you saw, it's all dead skin, keratin. So it was really thickened, so you call that hyperkeratosis. And I had to use drops on a couple of occasions. Initially, I used some medical grade olive oil spray, but it wasn't really effective. And then I introduced some sodium bicarbonate drops. The sodium bicarbonate drops generally works better with skin. So that's because when you introduce sodium bicarbonate drops into the ear, it reacts with an acid which is secreted by the bacteria that feed on the sebum. So the sebum is the oily lipid secretion, also found on our scalp, secreted by the sebaceous glands, which are connected to the hair follicle. So you get bacteria feeding on that, and they release a carboxylic acid. So sodium bicarbonate drops reacts with that acid, and it transforms into water and carbon dioxide, and that during that transitional phase from a liquid to a gas with the carbon dioxide, you get effervescence, you get bubbling, so it can help break up skin cells. And also although the skin cells are filled with keratin, they are by nature hydrophilic, so they like to also absorb water. So there's a bit of water absorbed by these dead skin cells. We call them corneocytes. And it causes the skin cell to swell and expand and burst at the membrane. So it's a bit better with skin. And then you can see we peeled away 2 layers. There's a little bit there. There's just a tiny bit on the annulus, which is the white rim around the eardrum. So the annulus is just some fibrocartilage. It kind of helps to stretch the eardrum to give it its tautness in the past tense of the main body. And it's kind of sits in a groove around the end of the ear canal. The tympanic ring is the end of the ear canal, and you got a ring. There's a little groove there called the tympanic sulcus, and the annulus kind of fits in there, and it just helps to stretch the eardrum. And there's a bit there to the right. You can't see it at the moment because it's in the anterior recess, which is a hidden recess to the front of the ear canal. The front portion of the ear canal, you can see here, it bulges out. It's quite common actually, and it then curls back round. So I left that because it wasn't on the eardrum. It's not going to lead to any improvement in the patient's symptoms. It's a very difficult part to access. Now, immediately after, the patient wasn't sure if their symptoms did alleviate, but during lunch time, my clinic manager went outside for a lunch, and she bumped into the patient, and the patient informed the clinic manager that she felt her symptoms to have improved. So fingers crossed, and I'm going to wait to hear back from her. So hopefully she's feeling a lot better now. Take care, guys. Bye.